Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. Very pleased to have Dan Rubin with me here today. He is the Naturopathic Oncologist and the Medical Director at Naturopathic Specialists in Scottsdale, Arizona. Welcome to the show, Dan.
Thank you. Glad to be here. Thank you.
All right. Do you go by Dr. Dan?
Yeah, that works. Dr. Dan, Dr. Rubin, dude.
Excellent. So how long have you been in Arizona?
Heck, I moved out here summer of '94 from Chicago to go to naturopathic medical school.
Okay,
So
very cool.
31 years, so more than half my life.
Okay, and I would guess that oncology was not a big specialty option at the time. Is that right?
It was not a specialty. It was zero. We actually had to invent the specialty and present it to the state board and become accepted, because in the state of Arizona, as a licensed naturopathic physician, you actually are not allowed, it's actually official misconduct to refer to yourself or put yourself out there as a specialist, like saying specializing in dermatology or specializing in oncology. So in 2004, we invented the naturopathic oncologist by creating a national organization called the Oncology Association of Naturopathic Physicians and the American Board of Naturopathic Oncology.
Okay.
And it took us 13 years later, we actually were accepted by the Arizona State Board, the Naturopathic Medical Board, and I have certificate number 001, and I am officially a naturopathic oncologist specializing in naturopathic oncology.
Okay, well done. What were the biggest hurdles getting that credentialing?
Really, it was convincing the profession nationally that this was a good thing to do. There was at the time coming out of school in the late '90s, and developing this in '04, so only 7 years later, there was a lot of purists and old timers, so to speak.
Sure.
I mean, I'm kind of an old timer now, but the old timers back then weren't very interested in specialization, with the belief that naturopathic medicine should be independent of the diagnosis, or the official diagnosis, set of symptoms, and you use nature cure to guide you. But at the time, oncology was really starting to move very quickly. A lot of new drugs coming out, a lot of new science, and it's only accelerated from there.
Right.
But looking in 2004, I was like, okay, I'm only seeing people with cancer. That's all I do. I didn't do anything else. And I'm like, I need to protect the public, because they don't know how to differentiate my skill level from the naturopathic doctor down the street who only sees 5 people with cancer a year.
Right.
Who at the time, they don't study that a lot. It's like, I'm not a cardiologist. Don't see me for cardiovascular problems, dermatological problems, see me for oncology. And so that's why we really felt compelled to do what we did. And we did it. We did, and here we are. And there's a couple hundred board certified naturopathic oncologists on the continent. Nice.
I imagine there's been, I don't know, you know better for the timeline, I'm sure, but sort of a renaissance in health education and and sort of people taking charge of their own health program, if you will. What would you say is been the biggest change and win in terms of people being more proactive and taking control of their own? Obviously when you get a diagnosis like cancer, you start educating yourself and you start figuring out all the different options that are available. But have you seen it sort of hockey stick the growth or exponential growth in clients or patients reaching out? Let's start there.
Yeah. I think honestly, looking at it almost from a reverse perspective, I think the biggest win has been the toxification of America, with large corporate entities producing products that are just frankly toxic, that are now being exposed. And I think that's been getting us out of the curve of the hockey stick and shooting up the shaft of the hockey stick. the exposure and the recognition, because now there's something we can do about it. Additionally, with the ability to test so we can prove toxification, there's been some big cases that have come through the Supreme Court, especially one about glyphosate. And so people are now recognizing that there's microplastics in our clothes, in our food. There's really toxins everywhere. And so those that have stood by, the smaller organic farmers, the naturopathic physicians who stood by their values, and, us getting our licenses in the 90s, it wasn't like hip, right? Like, I had to be interviewed by my parents. They sent me to a psychologist to be like, sure you want to do this? Coming from the North Shore of Chicago, this really wasn't something that you did, especially since I have my BA is in existential philosophy. And, the joke is that my dad would always look at the Sunday paper and say, yeah, I don't see an ad for philosophers wanted, and then I said I wanted to become a naturopathic doctor. But when you know, you know. And so looking back, it's from a grandiose, and I'm not talking about a small scale. I'm thinking about that. What's that bumper sticker? Think globally, act locally. That's what's happening now, and there's a lot. Social media, to some extent, isn't the biggest win because it causes a lot of people to do the wrong thing.
Right.
Because they think
there's a lot of misinformation out there.
Yeah, there is. But I really think it's the toxification of America, which came to a head, and now there's the big fight back. And I'm not talking about general America. I don't see people in, I see a small subset of people in my practice, but it represents people that are interested in aspects of cancer care, from prevention all the way to, which we mostly do, is treatment of people with severe metastatic disease. And people realizing now that to some extent they were fooled. Me too.
Sure.
Me too.
Like from not necessarily glyphosate. What was the thing I saw a couple months ago? It was in some of the stuff I use, which bummed me out. It's an emulsifier or something, which is another
carrageenan, maybe.
Maybe it was.
Well, that's
like
a
that.
thickener, an emulsifier. Like
it was
topical products, or
it was like in I think my wife's Coffee Mate creamer, her sugar-free Italian creamer. I think it was also in some protein. Some of those Abbott makes these things, Premier Protein, those protein shakes. I think in there, things like that. Peanut butter was in Jif and stuff too, I think, and Skippy.
You want to look up Skippy and see if they're protein powder?
Protein drink. Anyway, it was. It
might be carrageenan.
Okay, that rings a bell. But
we'll
anyway, so in addition to that, but just the bigger mainstream stuff, we're talking about like the food pyramid being a lie.
Refined, yeah.
And
I don't know where
that.
Go ahead. Sorry.
Well, I was just gonna say I have some pretty healthy friends. One of them gave me glucose monitors to try this year. Right? You can get them over the counter now and stuff. And so that was incredibly enlightening to see the things that I responded to that gave me a glucose spike, which for our listeners, maybe you can explain that real quick for our listeners, why the insulin response and glucose spikes are important to be aware of.
Oh, yeah. So you're talking about the eventual cause of diabetes. What happens is the higher that we eat on sort of like the glucose index or the glycemic index, the more sugar we consume, especially unopposed sugar, meaning not opposed with fat or proteins, just sort of these empty calories.
Quick absorption.
Yeah. Then basically, hang on one sec, we're looking at, we looked it up, just digressing for a second. We think it might be carrageenan, but we'll get back to it.
Okay, thank you.
So then that requires your body to meet that sugar demand that you've put in with insulin. And the more you do that, the more you're going to spend your insulin, the more you're going to tax your pancreas, the more you're going to hit your insulin receptors. And eventually over time, especially when you get insult from other places, like if you're inflamed, if you don't have a lot of micronutrition, if you're not getting sleep, if you're stressed, if you're not working out, your oxygen dynamics aren't great, you could develop insulin resistance, which then if, let go, then you could develop type 2 diabetes, where you're just having ineffective insulin, and that sucks. And so with a continuous glucose monitor, which you were wearing, you were able to see, you were setting a goal and you were seeing probably how you feel in relationship to certain foods and how you feel in relationship to your glucose levels during the day.
Sure.
And we, for so long, I grew up I'm a kid of the 70s and 80s, right? I'm born in 69. So I remember we had a great candy drawer and our friends would come over because we had a great candy drawer and sweets, and we didn't know as much about it. And processed foods were really just coming on board online. And, with those, especially with ultra processed foods, which I think we're thankfully starting to come out of the ultra processed foods era. But the late 90s and, especially mid 2000s, there's a lot there in terms of ultra processed foods and a lot of the diseasing of America and seeing chronic disease on the rise, which our food supply and our, what's generally available to the public, frankly, is terrible.
Right.
Especially compared to other countries and bereft of especially micronutrition. We think so often about macronutrition, carbs, fats, proteins, but then there's subcategories of those as well. There's utilization of those. Then there's vitamins and minerals. Then there's micronutrition. Then there's things that you don't necessarily think about, like phytonutrients and phytochemicals, phytosterols, polyphenols, those types of things that you require, and they have roles in the body. Eating, it's eating more whole food, shopping the periphery of the supermarket, those types of things, which people know, but, sometimes it's just easier to grab something that's more comfort food. But nowadays, even faster food is more wholesome food. I think the supply chains have tightened up. And like I said, it's part of that toxification of America has really been something that we got kicked in the butt. And it's like, okay, we've got to change. And I think in my age group particularly, I'm starting to see a lot of adults, in their mid 50s who are like getting into the biohacking space. They've may not have been super healthy, in their 30s and 40s, and now in their 50s, they want to perform better. There's more available to them. They're further along in their career. They have some money that they can spend on devices. They're able to discriminate what might be BS and what might not, and they're kind of don't want to be on medications, that they're kind of sick of being sick, and they're seeing their parents who have gone through certain illnesses, and the world of prevention is here, I think.
Right. It's a big part of my story, right? My father had pancreatic cancer, right? So I'm trying to be more mindful of that and the things that cause that. And part of that might have been the glucose monitors and just seeing how fast-acting carbs and sugars and stuff can cause inflammatory responses, right? Which you mentioned type 2 diabetes, but I've also heard, and maybe you can weigh in on this too, Alzheimer's and cardiovascular disease and other things associated with such inflammation, but Alzheimer's being called type 3 diabetes. Can you speak to that? Have you heard that much?
That is not my focus. I'm an oncology guy, and so I could probably fashion a pathway where that makes sense.
Sure.
But I'm not an expert
but
on
just
that.
the inflammation associated with some of the stuff we eat in general has been like some people also, like myself, some people can have a beer and they don't get a big glucose spike. Some people have a beer and they do, right? It depends on you, but also I have a chai latte mix I thought I was being healthy with because it said sugar free, but it actually had maltodextrin in it, which has a higher glycemic index than sugar. So it was giving me a huge glucose spike, and even though it said sugar free on the label. So they knowingly.
See what I mean? This is what we were talking about, the trickery, the tomfoolery.
Right.
You brought up inflammation again, which is a central tenet of chronic illness. It would be appropriate to use, if we were to pick one word of what can drive ill health, inflammation, because it's so multifactorial. For instance, on my desk here next to the plant, this is an EMF diffractor. There's not a lot of chatter yet about electromagnetic frequencies, but harmful EMF is a scourge. It's a plague. It's not something that everybody understands yet. in the public, but it's something that we all deal with because almost all of us have 5G in our pocket somewhere or by our bedside. And I mean, what are we doing right now? We're on a podcast because we have Wi-Fi and we're using computers. And so EMF diffraction, I mean, if anybody's listening, this is really something to take a look at. I mean, every day I wear my EMF diffractor because I'm not really interested in high hertz waves coming into my body and those that are square waves. I like to diffract it. And so we've made our office through the Aries Tech products. I'm giving them a shout out because they're, from as far as I can tell, they are the highest science in terms of EMF diffraction. And we've had our space certified as an EMF safe space. I keep it here because I want to be right by it. I keep it, close to me. I have it on my phone. I have it on my computer. Have it in my house. It is a really serious thing, especially from a neurochemical perspective. And you brought up Alzheimer's as potentially a diabetes type 3, and so how could Alzheimer's? I mean, you're talking about the brain. You're talking about the nervous system, and right now, it's kind of like the great unsung aspect of chronic inflammatory disease, but now there's solutions for it. I mean, we have more and more patients that are actually turning their Wi-Fi entirely off at night. They have a master switch. They're getting rid of their dimmer switches. They're really taking this seriously. It's a big deal. So there are different levels of what you can do for that. Having EMF diffraction products is a great solution to everyday life because EMF, Wi-Fi, 5G, they're certainly have no chance of going away. So how do you live with it?
Right. That's one way. Are grounding blankets in your bed considered a protection then against that type of those frequencies?
Yeah, it's a way to preserve the type of 7 type hertz that the earth runs on to make sure that you're filling up with some of that frequency generators, listening to sounds, going to, here's sound baths that are analog, not digital. Grounding sheets can be useful, grounding shoes. There's a lot of technology coming out in that space. Diffraction is my favorite and most utilitarian method. Because it makes the most sense because it doesn't block it. You can't block it. If you block it, then your devices don't work. So you diffract it and you make it more understandable and let it or more inert to the body.
Okay.
That's what we do.
Yeah. As for our listeners, I have a PhD in neuroscience, and I used to do a lot of electrophysiology, which is recording from different muscles and neurons and tissues, and we have to do that with in a cage, a Faraday cage, to block out all of the interference and stuff, just to get a clean signal. But tissues clearly respond to where they're, particularly the more electrical ones. All tissues are electric, by the way. Muscles and neurons are more so. They have a potential difference across their membrane, but yeah, they're clearly affected by all types of electromagnetic radiation. So it's interesting. I'm fascinated by this. I've known that it's a factor, but how much and what kinds affect us more than others, I think is fascinating to see how the discoveries keep coming.
We are beings of light, sound, vibration, sometimes inexplicable, but we know what happens, why you shouldn't put your finger in a light socket, why we have things called electrolytes. And we are electrical beings. We can send signals to each other. You can sense when somebody's in the room with you. You know that. Everybody knows that. So ignoring that and thinking that, just like energy medicine, people poo-poo energy medicine or it's woo-woo, but it's like there's a reality there, right? We know long distance prayer for people, even if you don't know the person, can be effective. So this is a new era for medicine. Your work in neurophysiology, I would love to chat more about that because I'm fascinated with this. And actually, you brought up the Faraday cage, right? So you want to see actually what happens when there's nothing else affecting that test substance. You have to eliminate every source of electromagnetic radiation or frequency. So you have to go in a Faraday cage. So interesting.
Right.
Right.
So in addition to grounding wires, and which I've only originally saw those back in microchip. I talk business here in Arizona sometimes with people in that industry, and And those floor, they have to be dragging a ground wire where they walk around, right? Because a little bit of static can cause big problems in the shop and other things like that. So, is that the grounding wire, by the way, type of thing that they offer for people? They can ground your feet or shoes instead of insulate them with rubber.
I don't. I don't know. I don't have a
Okay.
pair. I haven't dug into that. I do
Okay.
know. We know do walking is great, especially because you have a water medium between yourself and the earth. But
Right.
I mean, people
Okay.
feel better walking on grass, right?
Right. Right. And
Walk on.
forest bathing in general
Yeah, but we
is very
separate ourselves from the earth, right? We
right.
walk on floors or cement. Like you said, we have rubber between us and the earth. Usually, there's a real thing there. There's a real
For
thing.
sure.
There's a change in humanity, and maybe we're
Right.
waning philosophical. I don't know.
Right. We don't get the proper air and the proper sunlight and all that stuff's very important.
But it all
Um,
matters from a cancer perspective because cancer is the mismanagement of cellular biophysiology, right?
right.
And a cell trying to survive in an environment that it's not used to. And so it has to alter itself and then it has to survive. And that's the birth of a cancer cell. And if it survives and replicates, which is usually the case, now you've given birth to a tumor. So all of this is relevant. All of this actually matters.
Right.
That's why you look at a system, and each person that comes in here is absolutely an N of one, but we're a human system, and we are all different. We're truly N of one, even though it seems like we're relatively the same. All we have to do is take a compendium of labs on people, and I can show everybody how they're different than the next person. But all of this is relevant.
Right. And I mean, genetic predispositions, environmental, right?
Yeah.
There's a whole bunch of different factors for that. But we were talking about a little bit earlier how sugar and the fuel you feed yourself. I've heard that back in the day, sugar was fuel for cancer, right? Food for cancer, which you want to change your diet and minimize the type of some nutrients you're giving your body so it can best fight it and not help the cancer propagate. Can you speak to that a little bit?
Yeah. Basically, we talked about sugar a little earlier on the podcast and how it's just, an American scourge and, can lead to various types of chronic diseases. And to your point about genetic predisposition, not everybody gets cancer. Not everybody gets Alzheimer's. There is a predisposition. Then you have to bring in sort of everything else and all your lifestyle choices. But what happens is that in general, when you're looking at cancer, not from a somatic mutation perspective, but from a metabolic disease perspective, the preferred fuel for cancer cells is glucose. And I mean, for all cells, right? They can't survive on ketones, but we know there's alternative fuel sources. Methionine is one of them, glutamine, different amino acids. But the issue is that cancer is not only highly metabolic, but very inefficient in that metabolicness. And the cancer cell is generally doing more work than the normal cell. So by doing more work, it's by nature going to require more metabolic input in the form of calories, in the form of glucose. But it's also very inefficient, about 18 times less efficient than a normal cell with it. So it requires more from two aspects. And that's why, quote, sugar feeds cancer. But look, if somebody sits down and eats a York peppermint patty and slugs a Coke, it's not like it's going to go right to the tumor and make it grow. There's a lot of interplay with hormonal activity, IGF-1. Insulin's a big player in this. So we talked about insulin earlier and how, the higher the sharper the slope of your sugar input, your insulin input, needs to meet those needs as well. So insulin is a big growth promoter for cancer cells. So there's a lot of science in there. So that's why looking at a very comprehensive lab index on people is better than just looking at a few things. And it's a lot what we do at our clinic is we take a deep dive, if you will, at the complex N of one comprehensive biophysiology of our patients. And I may look in a what we call a grand planning session, I may look at over 450 analytes during that time and discuss them with people. To me, it's still one lab test. It's one bodily system, and you have to amalgamate that and have a good understanding of the biophysiology of the human, or else, in my opinion, you can't come to the best treatment plan for that person or meet their goals for them. So that's a lot of what we do. There's a lot of complex inner work in that area.
Yeah, I'm sure. Okay, so Dan, is some of this work also what brought you into like your microgreens endeavor?
The microgreens was interesting. Some of my buddies had started a microgreens company. It's called Urban Roots Farms. It's in Scottsdale. It's an inside farm. And my love of plants, well, I went to their open house, and this is Ryan Keeley and Rob Lackabee. They were the founders, and I went to the open house, and I love plants. I'm a naturopathic doctor. We use botanicals all the time. And not just that, I'm a human being. Right. And we can't survive without plants. I mean, we all know we can't survive without oxygen, right? But we, for other reasons, we can't survive without plants. So I saw what they were doing, and I was just immediately just so engaged. And so I was invited to come in and join them, and so I did. And we recently just launched our freeze-dried microgreens product called True Micro, which is available to people. So it's all the goodness of fresh microgreens. I mean, we also, produce fresh microgreens. We actually bring those to a lot of the school districts around the area because school lunches have suffered for so long. And so we make these fresh microgreens, introducing kids to what it tastes like, what it means to have very fresh food.
Here's fresh, healthy food.
Here's fresh, healthy food. This is a plant that you eat. Yes. And for some that are less privileged, they're less affordable. Right. So we also make those available to the less privileged populations around the valley. But then for all, you can freeze dry them and preserve that nutrition because fresh microgreens go bad after 10 or 14 days, but freeze dried don't. So we just came out with True Micro, and we're just spreading the good cheer and the good news. True Micro is part of my pre-workout, actually. It's really great sustenance for a pre-workout. So I'm really interested in what we're doing. We're playing frequencies in the grow rooms, both audio frequencies, especially 432 hertz, which is a great healing frequency and we believe helps those microgreens. We see it, they grow stronger, they grow faster, or more efficiently rather. And then we've just brought in non-digital devices that use a coil to generate frequencies. And so those are now on the farm. And we're in the process of creating an EMF safe space so the microgreens will grow free of harmful EMFs as well. So it's really important because it's like the same as it's relative to a cow that grew up eating grass its whole life versus one that grew up eating corn. Right? There's a vibe, there's a frequency, there's an intention in that meat. Why would anybody ever want to eat meat from a cow that was fed corn? Their body doesn't know how to metabolize it, right? It's basically a sugar. It's where high fructose corn syrup comes from. It's a grain.
But would you want to eat a stressed out cow or a healthy one?
Yeah, I would argue that the emotions are in the meat. Right, you want to eat something that was healthy and happy and grew up eating leafy greens, walking around in the sunlight and wasn't mad and wasn't scared. And so, so that's how we feel about our microgreens. And there's a great deal of intentionalism in the growth of those. Not only in the growth, but the distribution of those. Thank you for asking.
Very cool. Very cool. So back to naturopathic specialists. How many providers are in that? Are you multiple locations, and then how many people are part of the greater company? Yeah,
currently we are one location. We had two. We had a Flagstaff clinic, and right now we are at 4 providers. Recently we were at 6, but one of ours just graduated our clinic, and a beautiful person, but became president of Sonoran University, which is our alma mater, where we all went to naturopathic medical school. Formerly known as Southwest College of Naturopathic Medicine. Dr. Al Schuler just recently took the presidency, so left our practice. But my wife, Dr. Debbie Smolinski, whom I met in naturopathic medical school, is here. She's not currently practicing, but she's helping to really create a really nice space here and run this place along with our manager and keeping oversight. But she graduated with me, so she's been around naturopathic medicine actually since before me. She was actually the 4th employee of that school as it was starting up, because I believe it was founded in 1992. She had a love for naturopathic medicine, so she found it before I did. And then we have Dr. Melissa Coates, Dr. Melissa and I have been practicing together, I believe, 19 years now. Dr. Coates is a board-certified naturopathic oncologist, same as me. has a wonderful practice. We practice together every day here. And we have a resident physician. Her name's Dr. Monica Graffius, a new graduate as of a few months ago from Sonoran University, and she's here as an oncology resident with a focus on pediatric oncology. So my practice is also heavily involved with the pediatric population nationally. And we see a lot of patients who come out of Phoenix Children's Hospital. We go there and we speak. We have a relationship with them, formally informal. And it was becoming overwhelming for me because there is very few practitioners in the United States that are naturopathic oncologists who will see children. So we do. So Dr. Graffius said she's very interested in that, and so brought her on as a resident. She does, adult and pediatric. Dr. Coates is just adult, and I split between the two.
Okay. So you international or just national patients or clients?
International. We've seen
Really?
patients from 21 countries virtually. Some
wow.
fly in. We still do it. We see quite a few people internationally from our ongoing referral sources, and we've been around a while. We're going on our 29th year, I believe.
Right.
And because there wasn't that many of us back in the late 90s doing this, and because of the work that we've done, I do work with an international clinic. It's called Immunoscene. It's I'm on board with them. We actually produce personalized immunotherapies. I was going to say cancer vaccines. Technically it is, but that word has gotten sort of some negative connotations. But we actually utilize patients' own tumor tissue combined with their own white blood cells, and very scientifically produce a cancer immunotherapy specifically and only designed for them. And we see lots and lots of people from all over the world. But this particular practice, naturopathic specialist, has consulted with people from 21 different countries, because back in the day, there wasn't a lot of us doing this, and not a lot of us doing telemedicine, but all states from all over the place. But we really, really appreciate the people who are in town sitting before us. I'm sitting in my office right now where I see my patients. I don't have an exam room in here. I have a big conference table with 5 chairs. We're all on the same level, a computer screen so the patient sees what I see. We have these chairs that I'm sitting in so we can accommodate families, and oftentimes families come in, they want to talk. And it's really keeping people on the same level, and having an exam table as the center point of the area where you meet with the patient, I think is very passé. It's not that we don't examine our patients. I mean, we have a full medical facility, but it's really, medicine has become so consultative in this realm, in the oncology realm. I'm not necessarily just doing a procedure. We're making very difficult choices, life choices for people. We're problem solving. We're investigating. Our website, our URL is listenandcare.com. We're listening, we're caring, and we are creating an argument every day. Look, my father was a lawyer. I was forbidden to be a lawyer. He said, "No, you're not being a lawyer." But I was a philosophy major, so I was trained to argue. And every day I have to create arguments for why I think something's going on, what I think lab tests mean, and why the treatment I want to give is relevant to the diagnosis that I've made. And that's a form of an argument, because at the end of the day, we simply just don't know all the things that are going on with cancer. We're still, we're stuck either in metabolic versus somatic theory of cancer. And so treatments sometimes and oftentimes just don't work. So we need a better way. So this is part of how we've created a better way. We combine that with the immunotherapies from Immunoscene, the immunotherapies we do here in Arizona, nutrition, full scope, everything that we've talked about and way more.
Okay. How do people, most people, I don't know if kids or adults or both, find you?
Most of them are by referral.
Okay.
Usually people come in and say, 3 people referred you to me. We have, sharing our credentials, we have an Instagram page, Naturopathic Specialist LLC. We have a podcast. The podcast is called Rubin on Point. It's available on YouTube, on Spotify. If you want to watch the video portion of it, as well as the audio, and on audio only on Apple Podcasts. But it's on all the platforms. And I'm sitting in the podcast studio right now, so this may look familiar if you see this podcast and watch ours. We have our website, listenandcare.com. We have a phone number. It's a wonderful phone number. It's 480-990-1111. People reach out by the website, and the best is that we have a phone that gets picked up and answered with a human voice on the other end of the line when people call. And some people stop by. Believe it or not, some people come by and say, you know what, this is so important to me. I just wanted to drop by your office and drop off my records, and I want to make an appointment. And that's the most expeditious way.
Okay. People. So do people come to you when they get early diagnoses? Is it usually stage 1, 2, 4? What?
Yeah, no, it's a great question. More and more recently, people are coming to us with earlier stage diagnoses, which of course makes it a lot easier for them to realize the status, having no evidence of disease eventually. But there are still a lot of people who are now, quote, willing to try something different or something non-conventional. And those are usually people who have exhausted. They're with advanced disease, so they're people with stage 4 disease, and they've exhausted sometimes all their conventional options except for clinical trials, which does make treatment quite a bit different.
Sure.
But we see all ages and all stages. But the sooner after diagnosis, the better, because there's more we can do. The sooner we can test somebody, even before they start any treatment, even surgery, literally the better. The more information I can extract from about their biophysiology while the tumor is intact, I now have a different story that I can tell. And that first chapter that we read about them, I really need, because we create that story for them, and it's hard to really form an ending without chapter 1.
Yeah, knowing where you started.
Yeah, it's important.
Okay. Yeah. Okay. Very good.
Thank you.
Do you have anything coming up? Are you any plans for expanding other locations? Are you growing any big endeavors for 26?
No, not really.
Okay.
Not really. No, we're not. I mean, we have a nice facility here right on the Scottsdale Healthcare Honor Health campus, right at Shane 92nd Street. We're right across the parking lot are multiple oncology practices and the big research pavilion. And we do a lot of telemedicine for people that are either some people in state can't, they simply can't come see us, right? They can't get out of bed, so we have to treat them from afar. I think also really becoming continually and more involved with our 501c3 partners. We have the Joy Bus, which I'd like to talk about a little bit because it's a staple in Phoenix, and also the Phoenix Cancer Support Network. These are two wonderful organizations that are not for profit, that are there for people with cancer. And Phoenix Cancer Support Network is Jenny Martin and Sam Martin. They started this. They just recently had their gala that we were at, and they are there. We work a lot with them. We really enjoy working with these not-for-profits. It's, we give back every day, but this is another way, for a give back. And then Joy Bus, that was founded by Jennifer Caraway. I've been with them. I was on their board for a good 6 years. They have the Joy Bus Diner, which is around 32nd Street and Cactus or Shea, I believe. A wonderful 501c3. You can look up both on the internet. The Joy Bus Gala is upcoming, and I just wanted to give them a shout out because they're so integral to the Phoenix cancer outreach and just the whole what's going on in Phoenix, because they help people afford treatments, they help people afford good food. Joy Bus is all about food, and Phoenix Cancer Support Network is all about helping people with their day-to-day and afford treatments. And so working with them is, continuing work with them is relevant to our upcoming 2026. But expanding our treatment repertoire here, I guess. So we're not having a new footprint, but we're changing the footprint. We just had an article actually just dropped last week in Biohack Yourself magazine. So establishing ourselves in the biohacking world has been really important to us. And there's a lot coming out about biohacking, but you have to be really careful on how you biohack when somebody has active disease, or is it a high chance for recurrence? And we help people sort really through that. And that's a new buzzword, biohacking. Continuing the podcast and really developing those relations there. And there's staying on top of things, because we're really there to help protect the public. That's why we invented the Naturopathic Oncologist, is to help people understand who to reach out to when they have questions, and to keep people safe and keeping them towards that goal of no evidence of disease or not having any cancer come back.
Right on.
Okay. Thank you.
Awesome. Very good stuff. All right. Thank you. Thank
You're
you.
welcome. Thanks for having us.
This has been great. Thank you, everybody, for listening and watching. Thank you again, Dr. Rubin, for joining us today.
You're welcome.
And sharing all your insights. And I have more questions for you, but we're out of time.
Thank you.
Maybe another episode. Thank you very much. Have a good one.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.